Hey guys, welcome to CPD Junkie podcast, where we bring you interviews with dentists sharing their CPD stories and journeys from around Australia. What better way to learn than to follow those who've already done it before? CPD Junkie is Australia's most comprehensive CPD, so head over to cpdjunkie.com.au and become a member for free to access the full features of the site. I'm your host, Laurence Doan, and today we're joined by Dr. Bryan Bluhm. Dr. Bryan Bluhm grew up in Newcastle, New South Wales, where he initially completed his electric trade. Upon gaining entry to Griffith University, he made the move to the sunny Gold Coast, where Bryan went on to graduate with the Masters of Dentistry in 2019, in which he achieved the Chancellor's Award of Academic Excellence. He works at Oasis Dental, where he enjoys all aspects of general dentistry, although he has a passion for cosmetic dentistry and a unique interest in oral surgery. Dr. Bryan Bluhm, welcome to the show.
Thanks, Laurence. Thanks for having me today. Appreciate it.
So, tell us about your CPD journey so far and how your passion for cosmetic dentistry and oral surgery came to be.
CPD kicked off, I suppose, in the middle of COVID when we really didn't have any CPD to do. Everything was in lockdown. I just graduated. I just got a job, and about 2 weeks after getting the job, I was told you've got to go back home again. So that was a bit weird. Fortunately, through DPR, Derek Mahoney actually opened up his own free lockdown CPD. And almost every day there was a couple of hours of CPD just being released for free. So as broad as that was, and in areas that I wasn't even interested in, I was just watching absolutely everything I could, taking lecture notes, in the hope that maybe one day it could be useful and I could make use of courses that I'd normally spend money on. So that was probably where I started my CPD journey.
Right.
The interest in oral surgery came from uni, and starting off on wisdom teeth, trying to gear toward implants one day. And I suppose I think social media is probably the biggest influence in terms of cosmetic work, looking at everything that Oasis does, everything that, people like Tony Rotondo do. And you can't not have an interest in being able to revamp someone's smile and change a life. And then I got the job at Oasis Dental, where we do have a very heavy cosmetic focus that's supplemented with Invisalign and Prosthodontics, to try and bring everything together for our patients.
Yeah. Well, talk about that lockdown part. I remember when I was going through that too. There was so many CPDs kind of coming all together. Did you kind of feel overwhelmed by the daily amount of CPD that was webinars being produced?
Very much so. Yeah. Yeah. And honestly, it was just the fact that I knew that Derek had already done so many good little residencies, that this is the person that's only going to get, top-notch kind of speakers. So I just sort of tunnel vision at that, didn't look at anything else, and just made notes on whatever I could. There's a lot of good stuff in there. I think he still has it available now. It's not as comprehensive and not as much is available, but simple things like photography courses, knowing how to take actual good photos of your work, what kind of camera setup to buy as a new grad or as any dentist. Simple things like I hadn't been doing Invisalign just yet, but at the same time, they were talking about how to deal with issues that were coming through with Invisalign or things not tracking. It's all stuff that you really want to know if other people in your practice are actually doing that kind of treatment.
Yeah. So. And then, so after you went through all those webinars, did you end up going on to now? Have you attended any hands-on ones or?
No, look, with everything that's happened, I just stuck to the local stuff that was still open. So I've gone to the ADA and in Bowen Hills and done their cone beam course, which is very helpful. We do have a cone beam at work. And other than that, Invisalign, which is now done all online. So I guess the only benefit of this is you can save yourself all the money associated with travel and accommodation and everything else. You don't get to network as well, or learn from your peers. But at the same time, it is still quite helpful. And it's kind of pushed everyone toward a digital sort of way of doing things where we can just sort of send someone a message online and get a reply back and get some sort of help with treatment. So I found that to be quite good. So Invisalign at the moment, and then the cone beam course, and yeah, see where we go from there.
Yeah. I mean, I know at your workplace, particularly, you guys have regular team meetings and education. One of the reasons why we had to move it to pre-recording as well was for that. I mean, how's that been like at your workplace?
It's honestly the best. It's like a blessing that we can still do that, because it's almost its own CPD. In a time of lockdown, everything else, we can still put masks on and we can still go to our place of work and have a meeting there, almost like a normal work day. It's actually really good. We do an Invisalign study club, which is generally hosted with Barat and the local Invisalign rep, and just going through updates from Invisalign's end and then working through cases together. Aside from that, there's the normal team meetings that every workplace goes through, just to try and keep on top of things. But then running through cases, shortfalls that people have had, how to remedy it, and just sort of working through and I suppose learning from one another's mistakes has been fantastic, but also bringing the practice together so that no one is really an individual sort of, I suppose, entity, that everyone's a cog in the wheel. Even simple things like referring within the practice to one another, making sure that the patient is fully aware before they go to our implant surgeon, Andrew, what their options are. They've talked about everything. They know why they're going there, and just sort of, I suppose, streamlining our care more than anything else. But that's from a practice perspective. Obviously, the partners would want to do that. From our perspective, we're learning how to all integrate together and how to deliver treatment options to a patient where they're willing to go ahead, where there's no confusion, and we can give comprehensive care at every step of the line. It's almost like us working with specialists like we do every day through our referrals.
Yeah. I mean, I think that's an interesting point to have, a program to have, because a lot of times we would attend a weekend course and then there's no follow-up in it, but you've actually got a study club within the practice that teaches you and then goes through the process with you to make sure you run out or smooth out all the edges and all the bumps along the way.
That's exactly right. Yeah, that's what you want to be doing, and the more that you can do that, the more you can, I suppose, have a practice all on the same page. And if that's happening, then the patient, it's almost like if you go to a good hairdresser, and you can walk in there and go to anyone, and it's going to be good. And that's what you want to, I suppose, create for your patients at the end of the day. And not only that, we're all learning along the way behind the scenes from people like Brad, who's literally one of the best dentists in the world, as far as I think most people are concerned. And that in itself, being able to just sort of, I know a lot of grads are always asking for mentorship, and they even go so far as to get it written into their contract. But forcing people into that, I don't think is ever going to work. So much as having, Dr. Niall Quigley behind me as well, and all these fantastic dentists that I can just turn around and go, I have this that's just happened in my room. How would you manage that? I have this coming in tomorrow. What would you do here? Just having that open communication, being able to ask questions of senior dentists is really good in, I suppose, in a new grad's journey. Having something ironclad written into a contract is not going to get anyone keen to really help you, I suppose.
Yeah. I mean, I saw you had some pretty interesting rubber dam skills. You were able to rubber dam clamp 2 contralateral molars at the same time at one point?
Yeah. You watch Barat enough and you learn a lot of things.
So, of all the CPDs, what's been a game changer for your dentistry today?
I think mentoring and just sort of watching is invaluable for anyone. There's always going to be someone that has more experience, that's had all the same issues, and finding someone that is willing to impart that knowledge rather than hoard it as though you're their direct competition is massive. I can go and watch the partners of my practice any day of the week, and they'll explain things to me every step of the way. I think that is extremely important. But I think the biggest sort of changes have just been like, as I suppose reduced as the experience that I have with CPD so far, is literally just having all these online sort of, and the other one would probably be the fact that we now have the Invisalign study club, where of an evening once a week or once every 2 weeks. Aside from that study club, we also have direct mentoring. Should you choose to take it on for more difficult cases, you bring the case to the individual mentoring, and we'll all do a Zoom meeting. We'll present the case and we'll run through it with shared screens, the exact thinking process behind every movement, every planned action through Invisalign, and being able to do that and understand the thinking rather than this is the before, this is the after, and you just do that and everything will work as long as you do that. That teaches no one anything. And I think the most important thing for anyone is asking questions. And okay, you did this, but why did you do that?
That's right.
And finding the understanding behind it. Only then will it sort of embed into your knowledge.
And then learning from other people's mistakes as well on the way. Hey, so you don't make the same mistakes.
Yeah, exactly right. Yeah, definitely. And I only just put up recently on my Instagram like a before and an after of a single veneer, and the amount of conversations I had with different dentists in the practice to get that right, and what level to prep to and how deep to prep and everything else. And it's a good result. It looks all nice on social media, but that was multiple sort of hours of like discussing and then looking online and all these kind of things. And I suppose I've never walked into a procedure blind. If you know what you're going to do, go and do a bit of background research, have an idea of what you're doing. I remember the first time I did my first Zoom bleaching appointment, I read the manual back to front. I watched online tutorials on YouTube, and by the time it came, it was all pretty logical what to do. But just prep, I think, is everything.
Yeah. I guess that's an interesting point to take away, because a lot of times when we're going through uni and then we're looking on the outside and we're looking at how other dentists are doing or posting it, you're thinking they're just talented. But actually what you're saying is there's a lot of hard work and preparation behind it in the lead up to it.
Yeah, I think you're completely right. That's exactly what's required. You know, we got taught how many lectures before you did your first crown prep. And this is, it's just a simple crown prep that I did in this case, but there's so much more involved, and there's so much more you can read and research in the background prior to doing anything that can prepare you. And I suppose that in itself is something that I've heard David Attia say it. I've heard Dean Lysenblatt say it. You got to crawl before you can walk before you can run. And if I went and did an implant course right now, I've done heaps of wisdom teeth, but there would be no benefit to me doing that unless I start with the basics and know the theory behind it. Do your first bit, go from the walking to then eventually the running. So foundations, I suppose.
Yeah, fair enough. So you actually did some oral, you were an OHT at one point, were you?
I did my first year as an OHT, down in Newcastle, as a stepping stone, because I was not ready for uni with my grades from high school to go to uni, but I was able to get into a Bachelor of Arts, funnily enough. Spent a year doing every single oral therapy course I could that they would allow me to within the program, because it's quite broad. And that allowed me to transfer into therapy, did a year of therapy and got my grades up enough to transfer into dentistry on the coast.
Was there any overlaps that you felt like that might have helped in your dentistry career today?
I think in first year you always take away the basic anatomy and everything else like that. But patient communication is probably one of the most important things. It doesn't matter how good of a dentist you are at the end of the day. If your communication is not there, you'll only ever do simple procedures, because people will only ever see you for simple things. So communication is everything. I think that's probably the most transferable thing that I took away from that.
Well, one of the interesting parts is like some of the things that we might be doing is more wants based versus what's needed based. What's your take on that?
I think that would be the biggest comparison there would be between public and private. And I suppose in public, people are there for needs, pain, and there's obviously the biggest motivator, chips and things like that, versus private, where people are coming there for wants. They want veneers, they want white teeth. I suppose the biggest hurdle to overcome is, again, communication is the cornerstone and the foundation of everything. Being able to get your patient to understand that we need to lay a good foundation to be able to do good dentistry afterwards. Your veneers are not going to work with perio, like the basics that we all know. So I think that answers what you're asking.
And I guess it's kind of like, if, a single tooth restoration, or, whether it be a crown or something like that versus a full mouth, kind of you're needing veneers to kind of set it all back in form, isn't it?
Yep. And I think that in itself is so fundamental to any cosmetic work, because your patient, and you see this time and time again, you replace that one crown that they've been looking at this whole time, but all that does is redirect their attention to everything else that's now wrong, because they're now so focused on their smile and they're looking at the mirror about 5 millimeters away from it, and so we have to, I suppose, treat our patients from a holistic perspective and redirecting them to, once that bit's sorted, then we've got to go to this as well. And you've got to look at everything as a whole in order to treat the patient properly and have things that will actually last, and dentistry that will last. And again, the want is to fix one problem and the patient has the blinders on. We need to actually open their eyes to everything else. And photography is so important. They're being able to blow up an image of their teeth and giving them the pointer and saying, what do you see as a problem? And can you see how this could also be a problem if we do that?
Yeah. Has there been any particular CPD that you didn't feel that you implemented or was not as beneficial for you at the time and you would do differently next time?
Again, I suppose all of Derek Mahoney's things, there was a lot of stuff there that I watched almost everything. I think it's that crawl before you walk or before you run again, because I was watching implant stuff that's absolutely no use to me right now. I have no understanding of that. Watching like obstructive sleep apnea lectures with no fundamental understanding of things like that. So I suppose really having those basics. There were courses where I did the very basic sort of getting the right start to oral surgery that Sue Weong did in Derek's stuff. And that's good. That's teaching you about like looking at not just an extraction, but what follows the extraction. But there's a lot of things where you can get distracted easily. And some of the best advice I ever got was trying to not specialize in everything all at once. Find one or two interests and focus on those for anywhere from 3 to 5 years. Absolutely nail those before moving on to anything else. Otherwise you'll end up a jack of all trades and a master of none.
So who has been pivotal in your career path and why?
I probably have to give that credit to a few people. Brat comes first, and then everyone else that I really work with. Pivotal because of the motivation, the drive, the passion that he has for it, and the complete willingness to teach others what he knows. I can spend a day with him and have almost a hands-on veneer course explained step by step to me, and just learning bit by bit. And if I went and did a veneer course without having done too many cases, again, a lot of it would go over your head, as opposed to doing a lot of veneers and then you do the course and then it all kind of fits together really well. But just being able to stand behind him and learning little bits along the way, and then it slowly pieces together. And his knowledge is broad across sort of every facet. So I'm learning anything from bonding to preparations, rubber dam, just everything. So I could go in any day that I've got a problem or before a case, watch him do it and go from there. So he's probably been the most pivotal. And even in CPD direction, sort of giving that advice of, yeah, you can spend forever on PubMed to find one bit of information, or you can just go and get a prosthodontics textbook. Invisalign that I've been doing at the moment, Invisalign itself training is 2 days, and you can't really pick up as much as you need to be able to comprehensively do Invisalign. But then he's directed me toward clear aligner textbooks, and you open a textbook, and how often are you really going to read it cover to cover versus make short notes, turn that textbook into lecture slides like our lecturers did. And I just go back and reread that and reread my own notes that I've taken on lectures and online webinars Zoom meetings, going from there. And I suppose for new grads, that's one of the most important things that I found is that if you're actually doing a Zoom meeting, if you're doing a webinar, if you're getting that mentorship, write it all down. Like I'll spend that day with Brat and I will have my phone out every 3 seconds, writing notes upon notes upon notes, going home, summarizing it, writing it all up, and then I can always reference it. Otherwise, there's not really any benefit. We're not going to learn anything that we just sort of get overwhelmed with verbally in one day.
That's a good point to take. You know, any time you're learning something new, have it written down, and then after that, consolidate it all. So then you're really actively trying to learn what you've basically been taught.
Yeah, exactly right. It's the same thing that I'm sure most people do. And you go to CPD, you pull out your laptop, and away you go.
But a lot of times they kind of just close it and then they just forget about it. Hey.
Yeah.
So, have there been any particular struggles that you've had in your CPD journey so far that some of our viewers might not know about?
I think the biggest struggle is just the COVID stuff at the moment. You can't do the CPD you want to do. It's not accessible, and that's probably the hardest thing. I think, and I haven't really encountered it that much yet, but I'm fully aware that some of the biggest pitfalls are knowing what CPD is good. So talking to people that have done it, have done the course, I suppose would be a good starting point. Knowing what's good value for money, and just because it costs a lot of money doesn't mean it's going to be good, and that kind of thing. And comprehensive courses, I suppose, reading between the lines as well. There's a couple of courses regarding implants and whatnot that I've put to Andrew, and he said, like, if you actually look at the curriculum, there's a lot of buzzwords there, but it doesn't really seem to teach you too much. So paying close attention to the fine print and what's actually being taught, whether it's actually what you want to get out of it. I think that's probably the biggest things to be aware of, the pitfalls.
What's a bad day for you at work?
Procedures taking longer than they need to, if I'm being honest, because I think everyone says dentistry is stressful, and it is, but if you took away the time constraint, what would ever really be stressful? It's the fact that we've booked 2 hours for something we thought was going to take maybe an hour and a half, and now it's run into 3 hours, and now you've got people in the waiting room, and it's just that constant. It's that person standing behind you in the line at Woolies that is standing way too close because they want to get out. It's just that constant urgency. So I think time management is the biggest thing, and nailing that is going to lead to a less stressful day. But the days that I run over, they're the rough days.
Yeah, when things just keep piling on top of each other, it's just like a cumulative effect, isn't it?
Yeah, that's right. And then your lunch is short.
Yes.
And then that piles on. You don't get to unwind at all. You get a 5-minute bite to eat and you're back into it. And
So, what's your ideal clinical day look like? The type of procedures you might be getting up to?
Ideal clinical is sort of the things that you want to be doing, or at least a breakup. So if I've got a couple Invisalign patients throughout the day, if I've got some surgical cases, having some wisdom teeth, so that stuff, I think the things that I enjoy the most, and obviously Invisalign is related to all of your restorative and your cosmetic work. So gearing toward doing procedures that gear toward where I want to be in the future are probably the best. And I think just a breakup. If I see a day of new patient exams, or if I see a day of just fillings, they're the days that you sort of go, getting a little bit monotonous. So having a bit of a breakup throughout the day, I think I find best, and just sort of mixing it up, not doing the same thing all day.
So where do you want your ideal clinical day or non-clinical day to look like in 5 years' time? And what kind of CPD do you want to do to kind of get to that point?
Ideally, more cosmetic work in the books, and more Invisalign in the books. I think that's sort of where I'm gearing the most toward at the moment. And then slowly beginning to, at that point, I think I'd be at a point where I could be starting to do more implants. In terms of what that looks like and what CPD to do there, I'm going to be spending a lot of time on CPD Junkie trying to find some good courses.
No, that's fair enough. Is there any one particular course that kind of stands out to you, or you've got your eyes on that was pre, COVID, that you want to consider post after COVID? well, after this lockdown, all the borders open up again?
Yeah, look, the gurus of implantology have all gone to Frankfurt and done that master's course there. So that was definitely where I had my sights on to begin with. And I know that the IAA dental implant courses around here as well, in Australia, are available. So those are probably the two that I'd be gearing toward. But yeah, who knows what that'll look like, I guess, in the future.
Yeah, and so the implants is kind of more where you want to go in the long term, whereas in the medium term, it's more of the veneers, the cosmetic kind of dentistry that you want to do.
Yeah, and then look, I really want to solidify and just sort of that whole sort of concept of sticking with one or two things. So I really want to solidify my Invisalign knowledge before moving more down that cosmetic route, where I can use it to just supplement cosmetic work in the future and doing, full arch cases and full mouth rehab and all of that stuff that can then be supplemented again. If you can perform implants, then you can give your patient comprehensive treatment. You can do that full mouth rehab. And I think moving into the future, it's probably beyond the 5-year mark, but full mouth rehab in the future, as well as implants and cosmetic work, is probably what I'd like my ideal days to look like.
Well, Dr. Bryan Bluhm, thank you for coming on the show today. If you could let the people know how they can find you or what you've got going on in your life.
You can find me on the Gold Coast. At the moment, you'll find me mostly around the house doing all sorts of renovation work. We've got all sorts of downlights over here hanging from the ceiling, all sorts of things. We're painting the house, doing a lot of renovations. So around the house doing some work, using my electrical trade to help me out there. Other than that, you'll find me at the beach with my little French bulldog, who is currently asleep on the couch. You can see him there. And doing exactly what I said. I've been read those textbooks and try and learn the best I can from home, where you can just order a textbook to your house and start learning.
And what are some of those textbooks that you're reading right now?
At the moment, one of them is the Clear Aligner Technique by Sandra Tai, and just finished that. So I'm going to move on to Prosthodontics. I can't remember the exact name of it. It's on its way anyway. Prosthodontic guide, but again, another one that Brat recommended. So just sort of keep asking him what, I suppose, and you can, exactly what you guys are doing through the CPD at the moment. You just ask other people what their journey was. I asked Brad, I asked the other guys what they've done, and kind of follow in those footsteps, find what works for you.
Yeah. So, for all of our viewers, if you like this episode, drop a comment below on your favorite part, but don't forget to like and subscribe, and we'll see you in the next episode of CPD Junkie Podcast.